Let's go ahead and get started. Today's webinar module on the 100% project.
Thanks, John. So today during the webinar module, we will be doing an overview of the 100% project. So what it is, our approach to this work over the next 1.5 years or so, and as community partners, how you can get connected to this project if you are not already connected. So our overarching objective with the 100% project is to enroll and retain more kids that are under the age of 19 in health coverage. And we want to do that through targeted, intentional partnerships with schools and safety net clinics across the state. Some context for why this project. So overall, as likely a lot of folks on the line know, Oregon has a very low uninsured rate. It hovers around 3% for kids in our state. That is largely due to some really great legislation that has passed over the last decade in Oregon. The first being Healthy Kids, which opened up the Oregon Health Plan through CHIP expansion to literally hundreds of thousands more kids in Oregon. And then more recently in 2018 with the implementation of Cover All Kids, now all kids in Oregon, regardless of their immigration status, who are younger than 19 and meet income and other criteria, can qualify for OHP. So really because of those two pivotal pieces of legislation in our state, we have a lot of kids that are insured and that qualify for the Oregon Health Plan, which is awesome. Despite that, we know disparities continue to persist in our state, and we know that we still have some kids falling through the cracks in terms of access to health coverage and healthcare services. So we know that about 15,000 kids across Oregon qualify for Cover All Kids. However, today we only have about a third enrolled. We also know, due to Ocean Epic EMR clinic data that we received for 2018, that thousands of kids were actually seen across the safety net clinic system in Oregon last year who met the income criteria for OHP, but they presented at a clinic as a patient as uninsured. So again, we know there's some work to do there to fill those gaps and make sure all those kiddos are connected to coverage. And then lastly, we also know overall that about 15% of Latino adults in our state are uninsured. That's compared to an overall uninsured rate of less than 5% among all adults in Oregon. Yet, we also know that a majority of those Latino adults, I believe the figure is 8 and 10, actually qualify for full OHP coverage. So for whatever reason, they might not know it. There might be barriers to connecting to coverage, but those folks remain uninsured when in fact we know they qualify for OHP. And research shows that parents' insurance status is an indicator for whether a child will be insured or not. So again, there's some gaps that we need to address to really make sure all kids in Oregon are getting connected to health coverage through this work. So lessons learned. If you've been part of the Cover All Kids rollout, if you're a current grantee of our program, you know that since the launch of Cover All Kids in 2018, we've really tried to support our partners in making connections to schools for outreach purposes. And we've really tried to double down on the focus on working with schools for a couple reasons. So the first is we hope kids are in school, so it's a place to actually reach the target population that we're trying to reach. We also know, given the population that we've historically been trying to serve through Cover All Kids, that trust is a huge issue. And so we know overall schools tend to be trusted places for parents and families and students to get information and get connected to services that are important for keeping kids in school, healthy, ready to learn, etc. And then lastly, we know that having health coverage helps do all of those things. And so we've been able, relatively, speaking, to be able to make a strong case with schools for why they should partner with us in this work to make sure all of their students are insured. We've learned, though, through the last 2 years or so of implementation that there's some real challenges in working with schools. We've learned that not all of our grantees have had existing relationships with schools. Many of you had very strong working relationships with schools during Healthy Kids, but that program launched a decade ago. And so some of those relationships have changed, staff have changed, et cetera. So there's still work to sort of reestablish and reengage those relationships with schools. We also know that not all schools have been super open to having community partners through our grant program, partner with them, be on site to provide enrollment assistance, et cetera. So there's been some barrier and challenge there. We also know that it's been hard to target the outreach, to really focus on the schools that say have the highest rate of uninsured students, because many schools in Oregon don't actually collect that kind of data. So that's been a challenge. And then lastly, we all have limited resources and a lot of competing priorities. And of course, this is something that schools experience. So schools have a lot on their plate, and connecting students to health coverage might not be the first priority they think of in the work that they're doing. So we've taken sort of the last few years and the work that we've tried to start again with schools through Cover All Kids, and we've made some adjustments to the project and the approach to working with schools. So this slide summarizes some of those key changes that we've made. The first really important change is that we've worked really hard to try to get more leadership support for this work, both within our own agency at the Oregon Health Authority and, critically important, with the Oregon Department of Education. And that work and that engagement from leadership is now underway, and we know it's going to make a huge difference this time around. We're also working to really strengthen the case for why OHA and the Oregon Department of Ed, why the CPOP program and our partners should be working with schools in the education sector. We're making critical connections to the Student Success Act, which was landmark legislation that passed last year. Schools are going to have a lot more funding to do a lot more great things, and one of those is connecting students to healthcare services, which are critical for keeping kids in school healthy and ready to learn. So we're trying to connect OHP enrollment and the work that you all do to some of those key provisions in the Student Success Act. We're also trying to really focus on where we think there's the greatest need, meaning where we think we still have the largest numbers of uninsured kids that need to be reached. Thirdly, we are intentionally including not only schools in our outreach and sort of approach to this work, but we're also including safety net clinics. And I talked briefly about the OCHA and EPIC data in terms of painting the picture around the need. Again, we know there's a lot of low-hanging fruit opportunity to make sure safety net clinics across the state, who historically have been the sources of primary care for the kids that we're trying to serve, that those clinics are in the fold, in the know, helping us connect those dots and make sure all of their pediatric patients are connected to coverage. And we're piloting something new through the Cover All Kids program this biennium called Regional Hubs, which John is going to touch on here in a second. But that's an effort to intentionally bring together our OHP partners, clinics, and schools to try to serve kids in a more coordinated fashion. And then lastly, we're really trying to formalize the approach. So we are requiring that all of our grantees participate in the 100% project, and that this work be intentionally built into their work plans and deliverables for the grant. Our ROCs, our regional outreach coordinators, are dedicating a lot of time to supporting the project and supporting grantees in the work. And then lastly, we're doing something sort of within the umbrella of the 100% project, where we're piloting a deeper approach with 32 schools in Oregon. And John's going to talk about that here next. And before I pass it over to John, just a quick note. So we have identified, in terms of trying to target the work and not stretch ourselves too thin this time around, we've identified 11 counties as sort of priority for this work. And that is based on where we think we still have the most need, or the most kids that remain uninsured. So you can see those counties listed here on the slide.
Thanks, Josie. I think you've done a really nice job of sort of laying the groundwork of
why are we doing this now, and where we're at, and a sense of our history in Oregon. I think all of us can hold our heads high and feel proud about the work that we've done in Oregon, specifically as it's related to kids and making sure that kids are enrolled. But we really are at a time and place where I think we have some of our most difficult, hardest to reach kids still do not have health insurance, predominantly coming from communities of immigrants who are eligible. And yet in this project, we're going to do it to 100%, meaning that we want to go and do outreach to all kids in Oregon, but do understand that we do have pockets of specific populations that remain uninsured, and that I think we can all do a better job through a conscientious effort through this project to get there. So as I talk now about some of the specifics about the 100% project, we are currently piloting with 32 schools that have been identified, that we are working closely with the Oregon Department of Education to be able to leverage that relationship to encourage those schools to continue their participation. There's kind of a two-pronged approach here when I talk about the 100% project. And I'll first start by talking about the Lincoln Elementary School project, which occurred back in 2010 in Corvallis. And it really was a deeper approach with a very specific school to ensure that every single kid in that school was enrolled. So as part of that, they started by doing a scan of the school and survey of the school to find out who was without health insurance. Once those uninsured students were identified, then working with grantees and community partners, they were doing specific targeted outreach and providing enrollment assistance to those kids. As we talk about this project, the Lincoln Elementary School project, that's what it looked like. And as we do work with schools in this 100% project who would like to do a full 100% enrollment of their kids, this is the model that we're going with. So we'll first work on identifying kids who are not covered by health insurance and then doing specific targeted outreach to those kids. And our grantees will be providing health system navigation to address sort of what are the specific needs. We know that simply enrolling is not enough, and that part of the barriers is understanding how to navigate that system. So basically, we will ask our grantees and schools to measure and report on what the outcomes in by being able to identify a baseline of folks that are unenrolled and how many we need to get enrolled. And out of that, we'll learn some of the challenges that exist from that and continue to evolve as we improve on our 100% outreach. We do expect that even though we only have 32 schools that we've targeted specifically with this 100 school project, that will grow over time. And while we are specifically with this project talking about the specific 11 counties that we've identified, if you are in a county that's outside of this area, it does not mean that you couldn't also start a same project in your region. We are currently dedicating our resources in these 11 specific counties. We're also doing regional hubs. And basically, regional hubs are cross-sector collaboration in an effort to have a greater impact. The hubs, we have currently 2 hubs. Those hubs must include a culturally specific community-based organization. They must have an education sector, and they must have a safety net clinic. So really that effort is to ensure that kids who are in school, that we're getting those kids who are uninsured in schools. And in order to do that, we must have the schools or school entity involved in that process. Because we have so many kids that come from immigrant families, we want to make sure that we have a culturally specific community-based organization who is able to be that bridge and help and provide application assistance. And then safety net clinics, because we know that folks who remain uninsured continue to go to clinics and receive health care. If you happen to be a safety net clinic, one of the things I would say for you, one of your jobs is to go back and look at your OCHIN or EPIC or whatever data systems that you use and see if you can't pull the data of who in your system do you know in the last year came for services and were not insured, and maybe working with the ROCs and other community-based organizations or yourselves to do specific outreach to those families to ensure that they're getting enrolled. So our current hubs are being piloted in Clackamas and Multnomah County. That's one of our hubs. And the other one is in Marion and Polk County. And these are based upon population density and unmet needs. When we looked at the data and where the vast amount of folks were that remained uninsured, these were the counties, and that's why they were chosen. In Clackamas and Multnomah region, the lead, and each region has a lead, the lead for the Clackamas Multnomah region is the Oregon Latino Health Coalition, and in Marion and Polk counties, the regional hub lead is Interface Network. So basically, these hubs will be working to scale up their 100% project in those regions. As an example, within the Multnomah and Clackamas regions, Multnomah Educational Service District is our education sector. They have a broad reach across both counties, have staffing that are nursing staff as well as other types of staff that provide supports to those schools, and should be able to provide a broad reach and being able to funnel folks to make sure that they get the coverage that they need. So if you're a grantee and you know who you are, and hopefully there's a bunch of grantees on this, all of you are required as part of your work plans to be doing the 100% project. So some of you may be aware of that, and some of you may not. There may be other folks within your organization who manage the grant and your work plan, but within your work plan, there's an expectation that you'll be participating in the 100% project. So if you don't know exactly what that looks like, make sure that you're talking to your primary contact. Certainly be speaking with your ROCs, as they can help you with some of that. And really, we want to look on building on the existing partnerships with schools and safety net clinics and going from there. We want to look for as many opportunities as possible to integrate this 100% project into your existing program, your existing communication, and as you build new relationships, that it should be central to the work that you're doing. The next thing I'll say is that I hope everybody visits ohpcoversme.org. In fact, if you're listening right now, you could take a 1 minute or 30 seconds and open up the browser in the background, so that when we're done with this webinar, that you'll take the time to go to ohpcoversme.org to find some of the resources that are available there for you, which I'll talk about here in just a second, and become more familiar with it as we continue to add more resources to that site. It's also something that you can use at the local level. As you speak about it and what the goals are, I would encourage you to encourage others within the community to also go to ohpcoversme.org. So your ROCs can provide you lots of support in your community. They can provide you with technical assistance. They can sit down and plan and map out for you how you might go about doing this work. They're going to have a pretty good sense of what other community-based organizations within your counties are already working in the schools. Are there gaps that exist in the schools, and how you can maximize your efforts coordinating together to make sure that there's an efficiency in the outreach to these schools, and also that your local schools and safety net clinics know where to send folks when they need to either get enrollment assistance or navigation assistance. In addition to that, many of our ROCs have already worked with folks, whether it's at the state level or at a local regional level, with like migrant education, maybe with superintendent or principals, and so have some of those established relationships and can help leverage those to open the doors for you if necessary, so that you can insert yourself into schools to be able to do essentially do some of that outreach work and enrollment work. They'll work on strategies with you in terms of outreach and messaging, talk about what those referral relationships are, and then also what the data collection and tracking systems might look like. And we know on the outset here, as we talk about wanting to get baseline data about schools and who remains uninsured, that may be easier in other communities and much more of a challenge in other places. And we totally recognize that, but those are the things that they can help sit down, strategize with you, and begin to have those conversations with schools in terms of how that might be possible. Again, the Cover All Kids program webpage, ohpcoversme.org. Please, I expect all of you actually to go to that webpage and see what's there. In particular, there's a toolkit there that's coming soon that's going to be totally updated, that everyone should really take the time to become very familiar with it. It'll have flyers, postcards, social media cards, drop-in articles, swag, and more. So if you're having a challenge in terms of just even getting information out, you'll be able to find already written articles that you can send off to the principal of your local school. They can sign their name to it and put it into their weekly newsletter that the school might have that shares a little bit more about the 100% project. If you want to send out postcards because you're a safety net clinic, you could go ahead and distribute those postcards to everybody that you know that was uninsured in the last year if they had a kid who was likely eligible. So there's lots of different things there. If you want to just put up banners on your own Facebook pages or on your web pages, you'll be able to click and drag and use those social media banners to have on your web pages, which is pretty easy work. We've tried to do as much of it for you as possible, and you should be able to grab and use those. So please, I'd like everyone to make sure that they go see what those are and be thinking about how you can utilize those at your own organizations. There's also documents in there that I would say are like business cases. So if you're working with a school or your safety net clinic and you really want to make the argument about why it's important to be doing this work, we've already created a business case so that you can go ahead and utilize those and provide the documentation about the need and the why for this work. So there's also monthly county collaboratives. All counties and regions have collaboratives. If you don't currently get the invitation for the collaborative, make sure that you're reaching out to your ROC and they can make sure that you are receiving that so that you know the time and place when those are occurring. Great place to get updates on all of our collaboratives and the updates of what's happening with the 100% project. All right, that's it for our formal part of content. So thank you. I know that some of you have typed in questions. Or we don't have any questions. All right. So if you have questions, now's a good time to go ahead and type them in.